161. A nurse is teaching a patient with chronic kidney disease, CKD, about dietary restrictions. Which food should the patient avoid? A. Banana. B. Orange juice. C. Whole wheat bread. D. Grilled chicken. Answer: A. Banana. Rationale: patients with CKD should avoid high potassium foods, such as bananas, to prevent hyperkalemia. 162. A nurse is caring for a patient post-thyroidectomy. What is the priority assessment? A. Neck circumference. B. Swelling at the surgical site. C. Calcium levels. D. Oxygen saturation. Answer: C. Calcium levels. Rationale: hypocalcemia is a potential complication after thyroidectomy, and calcium levels should be monitored. 163. A nurse is preparing to administer a dose of digoxin. What is the priority action? A. Check the patient's heart rate. B. Check the patient's blood pressure. C. Administer with food. D. Check the patient's weight. Answer: A. Check the patient's heart rate. Rationale: digoxin should not be administered if the heart rate is below 60 bpm, as it can lead to toxicity. 164. A nurse is caring for a patient with pneumonia. Which assessment finding requires immediate action? A. Productive cough. B. Fever. C. Chest pain on deep inspiration. D. Cyanosis of the lips. Answer: D. Cyanosis of the lips. Rationale: cyanosis indicates inadequate oxygenation and requires immediate intervention. 165. A nurse is caring for a patient with a wound infection. What is the priority action? A. Administer prescribed antibiotics. B. Clean the wound with hydrogen peroxide. C. Change the dressing daily. D. Assess for fever. Answer: A. Administer prescribed antibiotics. Rationale: administering antibiotics is the priority to treat the infection. 166. A nurse is caring for a patient with hypertension. What lifestyle change should be prioritized? A. Reduce sodium intake. B. Increase physical activity. C. Limit alcohol consumption. D. Stop smoking. Answer: A. Reduce sodium intake. Rationale: reducing sodium intake is a key intervention in managing hypertension. 167. A nurse is caring for a patient receiving parenteral nutrition, PN. What is a priority nursing action? A. Check the patient's blood glucose level. B. Monitor the patient's weight. C. Assess for signs of infection. D. Measure the patient's intake and output. Answer: A. Check the patient's blood glucose level. Rationale: PN can lead to hyperglycemia, so blood glucose levels need to be monitored closely. 168. A nurse is caring for a patient with an acute exacerbation of asthma. What is the priority nursing action? A. Administer oxygen. B. Encourage coughing and deep breathing. C. Administer a bronchodilator. D. Place the patient in a high Fowler's position. Answer: C. Administer a bronchodilator. Rationale: a bronchodilator helps open the airways during an asthma exacerbation. 169. A nurse is preparing a patient for a colonoscopy. Which instruction should the nurse include in the pre-procedure teaching? A. You will need to take a laxative the evening before the procedure. B. You will need to remain NPO for 8 hours before the procedure. C. You may resume normal activities immediately after the procedure. D. You will need to wear compression stockings during the procedure. Answer: A. You will need to take a laxative the evening before the procedure. Rationale: bowel preparation with a laxative is required to clear the colon for visualization during a colonoscopy. 170. A nurse is caring for a patient with a cast on their leg. What is the priority nursing intervention? A. Assess for signs of infection. B. Monitor for signs of compartment syndrome. C. Elevate the leg to reduce swelling. D. Provide patient education on cast care. Answer: B. Monitor for signs of compartment syndrome. Rationale: compartment syndrome is a serious complication that can occur with casts, requiring immediate intervention. 171. A nurse is caring for a patient with cirrhosis. Which assessment finding requires immediate intervention? A. Jaundice. B. Ascites. C. Decreased appetite. D. Bleeding gums. Answer: D. Bleeding gums. Rationale: bleeding gums can indicate a coagulopathy, which requires prompt action in cirrhosis patients. 172. A nurse is caring for a patient who has just been diagnosed with tuberculosis, TB. What is the priority nursing intervention? A. Provide a mask to the patient. B. Initiate airborne precautions. C. Administer isoniazid. D. Encourage deep breathing exercises. Answer: B. Initiate airborne precautions. Rationale: TB is spread via airborne droplets, so airborne precautions are essential to prevent transmission. 173. A nurse is caring for a patient with a history of alcohol abuse. Which vitamin deficiency is the patient at risk for developing? A. Vitamin B12. B. Vitamin D. C. Thiamine, vitamin B1. D. Vitamin K. Answer: C. Thiamine, vitamin B1. Rationale: alcohol abuse leads to malabsorption of thiamine, increasing the risk for Wernicke-Korsakoff syndrome. 174. A nurse is caring for a patient who is postoperative following a laparotomy. What is a priority assessment? A. Assess the surgical site for infection. B. Monitor vital signs. C. Assess bowel sounds. D. Encourage early ambulation. Answer: C. Assess bowel sounds. Rationale: it is essential to assess bowel function after abdominal surgery to detect complications such as ileus. 175. A nurse is caring for a patient with a nasogastric tube, NGT, in place. What is a priority intervention? A. Check the placement of the NGT. B. Administer oral hygiene frequently. C. Maintain the patient in a supine position. D. Irrigate the NGT every 4 hours. Answer: A. Check the placement of the NGT. Rationale: ensuring proper NGT placement is essential to avoid complications such as aspiration. 176. A nurse is assessing a patient with a myocardial infarction. Which finding is most indicative of a heart attack? A. Right upper quadrant pain. B. Crushing chest pain. C. Pain radiating to the left arm. D. Nausea and vomiting. Answer: B. Crushing chest pain. Rationale: crushing chest pain is a classic symptom of myocardial infarction. 177. A nurse is caring for a patient with a urinary tract infection, UTI. Which of the following should the nurse include in the teaching plan? A. Increase fluid intake. B. Avoid urinating frequently. C. Drink caffeinated beverages. D. Wear tight-fitting clothing. Answer: A. Increase fluid intake. Rationale: increasing fluid intake helps flush bacteria from the urinary tract. 178. A nurse is caring for a patient with an ileostomy. What is an appropriate teaching point? A. Avoid foods high in fiber. B. Increase protein intake. C. Restrict fluid intake. D. Change the ostomy pouch daily. Answer: A. Avoid foods high in fiber. Rationale: high-fiber foods can cause blockages in the ileostomy, so they should be avoided. 179. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. What is the priority nursing action? A. Administer bronchodilators. B. Encourage smoking cessation. C. Teach pursed lip breathing. D. Provide supplemental oxygen. Answer: A. Administer bronchodilators. Rationale: bronchodilators are essential to open the airways in COPD patients. 180. A nurse is preparing to administer a unit of packed red blood cells, PRBCs, to a patient. What is the priority nursing action? A. Check the patient's hemoglobin level. B. Verify the patient's identity. C. Warm the blood before administration. D. Administer the blood rapidly. Answer: B. Verify the patient's identity. Rationale: the patient's identity must be verified to prevent blood transfusion errors. 181. A nurse is caring for a patient with a chest tube. Which finding indicates a complication? A. Tidling in the water-sealed chamber. B. Continuous bubbling in the suction chamber. C. An intermittent rise and fall of the water level in the water-sealed chamber. D. No bubbling in the suction chamber. Answer: B. Continuous bubbling in the suction chamber. Rationale: continuous bubbling in the suction chamber may indicate a leak in the system and requires further assessment. 182. A nurse is caring for a patient with a new diagnosis of diabetes mellitus. What is the most important initial teaching point? A. You will need to check your blood sugar every day. B. You need to monitor your weight regularly. C. You should follow a low-fat diet. D. You will need to take insulin for the rest of your life. Answer: A. You will need to check your blood sugar every day. Rationale: blood sugar monitoring is essential for managing diabetes and preventing complications. 183. A nurse is caring for a patient receiving chemotherapy. Which assessment finding requires immediate action? A. Nausea and vomiting. B. Hair loss. C. Mucositis. D. Fever. Answer: D. Fever. Rationale: fever can be a sign of neutropenia or infection, which requires immediate intervention in chemotherapy patients. 184. A nurse is teaching a patient about wound care after mastectomy. Which statement indicates that the patient understands the teaching? A. I should keep my surgical site covered with a dressing at all times. B. I should avoid using my affected arm for the next 6 weeks. C. I should apply heat to the incision site to promote healing. D. I should wear a tight-fitting bra to reduce swelling. Answer: B. I should avoid using my affected arm for the next 6 weeks. Rationale: avoiding the affected arm helps prevent lymphedema and promotes healing. 185. A nurse is caring for a patient with a post-operative wound infection. What is the priority nursing action? A. Administer prescribed antibiotics. B. Assess the wound for drainage. C. Change the dressing. D. Monitor the patient's temperature. Answer: B. Assess the wound for drainage. Rationale: assessing the wound for drainage helps to determine the severity of the infection and guide further actions. 186. A nurse is caring for a patient with a newly inserted central venous catheter, CVC. What is the priority nursing intervention? A. Check the CVC site for redness and swelling. B. Assess the patient for signs of infection. C. Verify the CVC placement with a chest X-ray. D. Flush the CVC with saline. Answer: C. Verify the CVC placement with a chest X-ray. Rationale: a chest X-ray confirms correct placement of the CVC and helps detect any complications. 187. A nurse is preparing to administer an intravenous for medication to a patient. What is the priority action? A. Verify the medication with a second nurse. B. Assess the patient's allergies. C. Check the patient's vital signs. D. Inform the patient about the medication. Answer: A. Verify the medication with a second nurse. Rationale: verifying the medication with a second nurse ensures patient safety and prevents medication errors. 188. A nurse is caring for a patient with a colostomy. Which statement indicates that the patient understands the teaching? A. I will avoid foods that can cause gas and bloating. B. I will change the ostomy pouch every 3 days. C. I will only wear loose-fitting clothing over the stoma. D. I will irrigate the stoma daily. Answer: A. I will avoid foods that can cause gas and bloating. Rationale: avoiding gas-producing foods helps prevent discomfort and complications with the colostomy. 189. A nurse is caring for a patient with an acute stroke. What is the priority nursing action? A. Assess the patient's airway. B. Administer aspirin. C. Elevate the head of the bed. D. Perform a Glasgow Coma Scale assessment. Answer: A. Assess the patient's airway. Rationale: the airway is the priority in acute stroke management to ensure oxygenation and prevent aspiration. 190. A nurse is caring for a patient receiving opioid analgesics for pain management. What is the priority nursing action? A. Monitor for respiratory depression. B. Assess for signs of constipation. C. Check the patient's blood pressure. D. Evaluate for signs of opioid addiction. Answer. A. Monitor for respiratory depression. Rationale. Opioid analgesics can cause respiratory depression, which can be life-threatening if not detected early. 191. A nurse is caring for a patient with a suspected myocardial infarction. Which assessment finding is most indicative of this condition? A. Diaphoresis. B. Pain radiating to the right arm. C. Severe right upper quadrant pain. D. Decreased heart rate. Answer. A. Diaphoresis. Rationale. Diaphoresis, sweating, is a common symptom of a myocardial infarction due to the stress on the body. 192. A nurse is caring for a patient with a history of peptic ulcer disease. What is the priority intervention? A. Administer proton pump inhibitors, PPIs. B. Encourage the patient to eat small, frequent meals. C. Monitor for signs of gastrointestinal bleeding. D. Advise the patient to avoid spicy foods. Answer. C. Monitor for signs of gastrointestinal bleeding. Rationale. GI bleeding is a common complication of peptic ulcer disease and requires prompt intervention. 193. A nurse is caring for a patient with Parkinson's disease. Which medication is most likely prescribed? A. Levodopa. B. Metformin. C. Furosemide. D. Lisinopril. Answer. A. Levodopa. Rationale. Levodopa is the primary medication used to treat the motor symptoms of Parkinson's disease. 194. A nurse is caring for a patient post-laminectomy. What is the priority intervention? A. Assess the patient's pain level. B. Encourage early ambulation. C. Monitor the patient's neurovascular status. D. Assist the patient in deep breathing exercises. Answer. C. Monitor the patient's neurovascular status. Rationale. After spinal surgery, it is critical to monitor for any neurovascular changes to prevent complications. 195. A nurse is caring for a patient who is receiving total parenteral nutrition, TPN. Which complication should the nurse closely monitor for? A. Hypoglycemia. B. Hyperglycemia. C. Hypokalemia. D. Hypernatremia. Answer. B. Hyperglycemia. Rationale. TPN can lead to hyperglycemia and blood glucose levels should be monitored closely. 196. A nurse is caring for a patient with a history of chronic bronchitis. What is the priority nursing action? A. Administer bronchodilators. B. Encourage hydration. C. Assess lung sounds. D. Provide supplemental oxygen. Answer. A. Administer bronchodilators. Rationale. Bronchodilators help open the airways and are essential for managing symptoms of chronic bronchitis. 197. A nurse is caring for a patient with cirrhosis. Which complication should the nurse monitor for? A. Dehydration. B. Hyperkalemia. C. Hepatic encephalopathy. D. Hypocalcemia. Answer. C. Hepatic encephalopathy. Rationale. Hepatic encephalopathy can occur in cirrhosis due to the accumulation of toxins in the brain and requires immediate intervention. 198. A nurse is caring for a patient with a hip replacement. What is the priority intervention? A. Assess for signs of infection. B. Administer pain medications. C. Encourage deep breathing exercises. D. Assist with range of motion exercises. Answer. A. Assess for signs of infection. Rationale. Hip replacement surgeries have a high risk of infection, and monitoring for infection is a priority. 199. A nurse is caring for a patient with a blood pressure of 190/110 mmHg. What is the priority action? A. Administer antihypertensive medication. B. Place the patient in a sitting position. C. Assess for signs of stroke. D. Monitor for signs of fluid overload. Answer. A. Administer antihypertensive medication. Rationale: a blood pressure of 190/110 mmHg is considered a hypertensive crisis, requiring immediate intervention with antihypertensive medication. 200. A nurse is caring for a patient with a history of seizures. Which of the following is a priority nursing action? A. Keep the patient on their side during a seizure. B. Place a padded tongue depressor in the patient's mouth. C. Restrain the patient to prevent injury. D. Monitor the patient's blood pressure. Answer: A. Keep the patient on their side during a seizure. Rationale: placing the patient on their side prevents aspiration and maintains the airway during a seizure.